Good evening, everyone. My name is Krivopalova-Moscvina Elizaveta, and I'd like to tell you about anti-stress epitherapy for depression by the Research Institute of Clinical Apitherapy in Russia, Chelyabinsk. In medicine, a new direction called psychosomatic medicine is developing. It considers all kinds of forms of stress as the main or concomitant factor in the development of various diseases. Psychological stress, anxiety, and depression are oppressed states accompanied by a constant feeling of sadness, anxiety, apathy, indifference to reality, and the inability to enjoy life. The number of depressive diseases is growing, and now up to 500 million people suffer from them. Moreover, women suffer more often than men. According to the World Health Organization, the diseases will have become the most common by 2030. Depression is a mental disorder characterized by persistently bad mood, emotional instability, irritability, motor retardation, and thought disorder. For each person, it's important how comfortable he or she feels and is able to adapt to society. The main indicators of favorable human adaptation in society: preservation of physical, mental, and psychological health, establishing contact with colleagues and others, adequate behavior, and the ability to master the skills of the necessary work activity. For adaptation, a comfortable state is necessary, and for its maintenance, sufficient work of pleasure centers in order to release the necessary amount of the necessary hormones. Treatment. The main goal of treating depressive states is to enhance the production of opioid peptides. Academic treatment isn't effective enough, and alternative treatments for depressive conditions are ignored, which is a misconception. Disadvantages of existing treatments. Physical impact involves, as a rule, drug therapy using strong medications, which is associated with the duration of taking antidepressants, which leads to addictions and dependence. A number of adverse reactions from the therapy. The need to seek help from a psychiatrist, which not everyone will dare do. So far, medical treatment of depressive states isn't effective enough to normalize mental, physical, and psychological health. There are several reasons for this. Firstly, the antidepressant takes on the function of stimulating pleasure centers, and the body ceases to perform the function independently psychologically, as a result, the formation of drug dependence. Secondly, while there are practically no medicines to can normalize physical and psychological health, conventional psychotherapy, not a short-term condition. Far, it's not effective enough in its level, as well as due to the unpreparedness of some patients for its perception. This makes the problem a lifelong one. The patient is treated for years, doesn't see the prospect, and doesn't feel the result. Chinese medicine sees depression as a manifestation of an emotional imbalance associated with all systems and organs. The mental balance and physical condition of a person are inextricably linked, and negative feelings and thoughts can lead to illnesses of the body. The human body permits and nourishes the vital energy of qi. Its source in the human body is the liver and spleen. Qi deficiency leads to alternate states. An important positive point is the fact that at one time, the World Health Organization recommended acupuncture for anxiety, psychological stress, and depressive neurosis. However, in our opinion, in depression there should also be a substance that can enhance the effect and influence the vital organ and systematic functions. We began to improve this direction, allowing to feel the result much better and longer against the background of the therapy. A new program for the comprehensive treatment of this problem has been developed, which allows to intensify the work of pleasure centers without forming another dependence. First of all, this is Apitoxin therapy, with the help of which, due to the content of dopamine and serotonin in the venom, the deficiency of pleasure hormones is compensated reflexively and biochemically. Secondly, amid increasing the sensitivity of brain cells with apitoxins, the methods of psychotherapy are improved more effectively. Thirdly, the program includes massage, psychotherapy, and various complexes of physical therapy aimed at additional physical and mental relaxation. Therefore, apitoxin therapy is the epitoxic, reflexive, and biochemical stimulation of hormonal pleasure centers by containing dopamine, serotonin, and other natural stimulants in bee venom. Epipsychotherapy combined the double-trans exposure, which allows by increasing the sensitivity of brain cells to erase the unnecessary from memory and impose positive emotion. Epikinetic therapy, contributing to relieving internal stresses. Yoga, honey massage therapy, epipsychological attitude to the correct perception of stimulation that cause stresses. Epithetotherapy. Indications for apitherapy: depression of mild and moderate severity, somatization disorder, depression in the framework of chronic fatigue syndrome, asthenic and depressive states in the framework of severe chronic diseases. Venom is the one of the few substances that contains a peptide that can penetrate the blood-brain barrier and directly affect the opioid system. Epinephrine increases the number of endorphins, pleasure hormones, as a result of which the patient feels psychologically more comfortable. Getting into the human body, it's able to influence the main neurotransmitters of mood, norepinephrine and serotonin, regulates the activity of the hypothalamic-pituitary-adrenal system, suppressing its activity in depression. Allows you to conduct psychotherapeutic trainings most effectively, correct anxiety states and phobias. Unlike antidepressants, it doesn't require a long-term use. Normalize somatic disorders caused by a decrease in mood. We get the result through a special scheme of Apitoxin therapy due to decreased serum corticosterone levels and immunoreactive thyroxine hydroxylase cells. Effects on areas of the brain that reduce sensitivity to pain and stress, as well as promote relaxation and deactivation of the analytical brain responsible for anxiety and concern. Improvement of stress-induced memory impairment and increased acetylcholinesterase reactivity in the hippocampus. Regulation of levels of neurotransmitters and hormones such as serotonin, norepinephrine, dopamine, GABA, neuropeptide Y, and acetylcholinesterase, hence altering the brain's mood chemistry to help combat negative affect states. Stimulation of the production of endogenous opioids that affect the autonomic nervous system. Stress activates the sympathetic nervous system, while apireflexotherapy can activate the opposite parasympathetic nervous system, which initiates a relaxation response. Reversal of pathological changes in inflammatory cytokine levels associated with stress reactions. Inhibition of stressful change in behavior and biochemistry. Hormonal effects that influence the intensity of secretion encoded in DNA and have a key impact of human behavior and perception of the world. The introduction of bee venom stimulates the production of the main neurotransmitters in the body, serotonin and dopamine, as well as endorphins, thanks to which the mood is raised. Method of antidepressant apireflexotherapy. To affect the neurotransmitter system, bee venom in these conditions is better to be injected into certain biologically effective points in order to most fully implement the reflex potential of apitoxins. During apireflexotherapy, there are significant changes in the electrical activity of the brain. The main role of the mechanism of action of apireflexotherapy is the connection of the autonomic nervous system with the skin-visceral relations, in which nervous and humoral mechanisms are involved in the processes. Based on this, we propose the following stimulation zones. Stimulation of the predominantly sympathetic nervous system, points located in the area of innervation of the trigeminal, glossopharyngeal, sciatic, tibial, perineal, median, and ulnar nerves. In the area of the auricle, areas innervated by the small and large occipital nerves. Stimulation of the predominantly parasympathetic nervous system, points located in the area of innervation of the facial, vagus, glossopharyngeal nerve, perineal, and sacral points. The area of the auricle, as well as point located along the paravertebral lines in the back. When choosing the formulation of exposure points for reflexotherapy in depressive disorders, we proceeded from the following main directions: stimulation and steadying of organs and systems that perform the functions of neuralizing and removing toxic products from the body, stimulation of oxidative processes, stimulation of regulatory nerve. The first session began with the treatment of the so-called points of restorative action. Then the posterior median meridian points are stimulated, as well as extrameridian and new points, depending on the level of anxiety and tension. In subsequent session, auricular points are stimulated. In conclusion, the points of restorative action are again processed. In the auricular points, the venom is injected with a stinger into the rest with a bee or a stinger. The proposed method of treatment is a new version of emotional stress psychotherapy, the main therapeutic effect of which is based on combining it with the immunostimulating effect of bee venom on the patient's body and introducing the patient into a state of double trance. Over the past 2 years, 31 patients with a depressive state have been treated at the Epi Clinic. Depth of the depressive state was assessed according to Hamilton Depression Rating Scale, according to Beck Depression Inventory. Patient assessment of psychological trait patterns were determined by the Symptom Checklist 19 revised. The course of therapy for patients with depressive disorders consisted of 10 days of complex treatment in the Epi Clinic. Therapy included epireflexotherapy, native bee stings in biologically active points, epitheliotherapy, injection of bee products, epipsychotherapy, combination of bee stings with method of psychotherapy and trances, epikinesiotherapy, combination of epitherapy with motor rehabilitation. The dynamics of the condition during treatment was determined by clinical methods and clinical and psychological studies. Dynamics of the main subjective complaints of patients during treatment. From clinical observation, it can be seen that asthenic complaints under the action of apitoxins are leveled in the first 3-5 days. In the middle of the treatment cycle, the whole complex of complaints is reduced, and by the end of treatment, subjective complaints are completely stopped. Dynamics of depression in the process of apitherapy according to the Beck Inventory. When tested at the beginning of the apitherapy course, according to the Beck Inventory, patients with mild depression were 93.2% with an average severity of 6.8%. At the end of the course of apitherapy, complete recovery was noted in 19.5%, threshold values of depression remained in 6.8%, and 2.7% remained symptoms of mild depression. Dynamics of depression in the process of apitherapy on the Hamilton Depression Rating Scale. At the beginning of the course of apitherapy, according to the Hamilton scale, 82.4% of patients had symptoms of mild depression disorder, 17.6% of moderate severity. At the end of the treatment, 83.8% of patients had a normal mental state, and only 16.2% of patients had mild depression thresholds. Dynamics of the main psychopathological symptoms in patients during apitherapy according to the Symptom Checklist 19 revised. When observing the dynamics of the state during apitherapy, complaints on the scale of somatization, sensitivity, and hostility were stopped faster. As early as on the 5th day of treatment, the symptoms were reduced by 50%. On the 8th day of treatment, on the somatization scale, improvement occurs in 73% of patients, on the compulsion scale in 53.3%, on the sensitivity scale in 73.9%, on the depression scale in 66.2% of patients, on the anxiety scale in 75%, on the hostility scale in 73.2%, on the phobia scale in 42.8%, on the paranoia scale in 64%, 46.1% and on the psychoticism scale in 50%. On the 10th day of treatment, the improvement according to the scale was between 30 and 98%. The less dynamics in treatment was shown by patients with high values of the scale of psychoticism, phobias, paranoia, which is associated with a great likelihood of having an endogenous process. Thus, clinical and psychological studies conducted at different stages of apitherapy prove the high effectiveness of apitoxins in the treatment of depressive disorders. We believe that apireflexia therapy should rightfully take priority among the available methods of treating depression. Thank you.